Hi everyone, my name is Xenia. I'm a fourth year student here at CSU Channel Islands. I'm a senior right now and actually came in as a transfer student with a major in pre-nursing. This May, I'm going to be graduating with my bachelor's in health science. Afterwards, I'm thinking about taking some time off and then trying to get into a master's program to become a physician's assistant. I'm taking this course because I've always thought of healthcare as being based on science and evidence-based care, but after taking a medical anthropology class, I realized that there was a whole aspect of healthcare that I was not very educated on. From this course, I hope to learn more about the other aspects that could play into healthcare as well. What I learn in this course, I can carry into my future profession as a physician's assistant to keep my mind open to other people's ideas about healing. The first question in this discussion asks, what alternative therapy practitioners require licensure in California? From the Science-Based Medicine website, I found that acupuncturists, chiropractors, and neuropathologists all require licensure. The same website also explains how the acupuncture licensure defines acupuncture directly while also leaving room for a broad ideological statement. So it kind of defines it broadly. And in California, legislation for chiropractic licensure is way more specific. So things like yoga, massage, and herbal remedies don't usually require any licensure. From the Good Therapy website, I found that physicians, nurses, and psychologists don't typically practice alternative therapy. And from the Complementary and Alternative Medicine in the United States article that was linked in our module, I read that it's their ethical duty to steer a patient away from alternative treatments that are known to be dangerous or have some kind of adverse interactions with the supplements or the medications that they're taking. So, although the two forms of healing aren't always used in an integrated way, it's important for the physician or the nurse or the psychologist to know about whether the person is partaking in any of these alternative therapies, just so they can kind of make a judgment and see whether there's going to be any form of negative interactions in their patient's health. So yes, that is what I found for this week's discussion. I look forward to reading your guys' responses and maybe taking a look at some of your guys' videos to see what you guys found on the internet. Bye!